Hi, welcome. My name is Natalia. I am a functional medicine nutritionist, registered dietitian, and we have been talking about the importance of having optimal digestive function because problems with the gastrointestinal tract can actually be underlying causes for more severe conditions such as autoimmune condition like rheumatoid arthritis, type 1 diabetes, and also rosacea. And believe it or not, it's also linked with heart problems. So I've been talking about the 5R, which is a program in the functional medicine spectrum that has been proven to really improve a lot of gastrointestinal conditions by looking at all aspects of gut health. So I recently spoke about removing foods and microbes when there's an overgrowth of SIBO, for example, small intestinal bacterial overgrowth is where the bacteria that should be in the colon actually migrate up into the small intestines where they shouldn't be, right? So, why does this happen? It happens because the body doesn't have the ability sometimes to make enough bile and hydrochloric acid, which, believe it or not, are actually antimicrobial, right? I explained recently how we have a balance of bacteria, microbes, right, that make our entire system, and most of them are fine in the gut. But what happens to lots of folks because of years of poor eating, a lot of stress, drinking, maybe too frequently, and some medications, and of course, poor diet sometimes is that these bad guys kind of take over. But some of the root causes that I tend to see a lot when I work with folks is lack of these antimicrobial agents that the body naturally produces, but they're not made. So, for example, if somebody has their gallbladder removed, it's gonna be a little more difficult for this person to make enough bile to not just keep these microbes at ease, but also to digest fat, right? So we need bile for digestive purposes. And also enzymes. Our body makes these workers, right, which are called enzymes in the medicine world, right? So if our body doesn't have the ability to make enough of these workers, it's going to be very hard to break down the foods that we're consuming into small enough pieces so that they can be absorbed by the gut lining. So the gut lining is very important. This is where that digestion, absorption, and metabolism really takes place, right? So if we don't have these workers that are needed to break these foods into smaller particles, then it's going to be very difficult to absorb a big chunk of particle, right? So that is two examples of two substances secretion that our body's supposed to make, and that if we're eating too frequently the body doesn't get a chance to make. So it's important to really space our meals apart at least 4 hours, and to really check in with yourself if you're eating out of boredom, if you're eating out of habit, or if you're eating out of stress, which happens a lot. So more to come with that, and next will be the re-inoculate R.